This is why you should meet with your plastic surgeon before surgery. And that's why I do it in my practice too. Let's talk about it. So it's come to my attention that there are practices out there in cosmetic breast and body surgery where the surgeon, the person actually going to be performing the surgery on your body, is never met or engages with the patient before surgery. You may find out who that person is going to be on your day of surgery. They may not have examined your body at all. These are all kind of red flags to me and in my practice. Why is that? Well, I think it's very important to come to the appropriate operation to be performed on you because there are different techniques that can be used. Maybe there are different priority areas to treat, in which case order of surgeries may matter. And sometimes you can't get all of that information just from a photo or from an emailed picture or a video chat. So physical exam in person is critical. At my practice, yes, we do virtual consultations, but we always follow that up with a preoperative visit where I sit down with the patient, I do an examination of the patient, trying to figure out what's best for you for your surgery. It also gives us a chance to see if we have a connection, a good working relationship, I think is very important. If anyone's ever done a major home remodel or whatever, it's much better to have a great relationship with your contractors than to not know them at all. This is very similar to that, except it's quite a bit more personal. So I think you want to have a good relationship, a good working relationship with your surgeon ahead of time. And if you have problems connecting with your surgeon before surgery, I would say that's also a red flag. And that's because some surgeries don't go as planned, right? There are such things as complications. And it's understandable, it's an emotionally charged event to have some complications after surgery. And that can stress that relationship that you have with your surgeon. And if you started off kind of not knowing the surgeon or on a kind of rocky basis with your surgeon, having that monkey wrench thrown at you can kind of destabilize that relationship, except it's at a very vulnerable point. You have a complication and something may need to be done. So I'd say very important, make sure you have a good working relationship that can, kind of tolerate the ups and downs in the recovery period. And you will be better off because of that. Not only emotionally, but I suspect also physically. So that's what we do here at Alamo Plastic Surgery is I meet with the patient. We're gonna chat, we're gonna do a detailed physical exam, and we're gonna come up with the right plan for you and establish a relationship that can get you to the end point. If that sounds like a great idea to you and you would like to set up a consultation with me, well, DM us, we'll set something up, and I look forward to meeting you.